Diabetic foot problems or diabetic foot infections are infections of the foot or problems of the foot like an ulcer or crack for patients with diabetes. Patients with diabetes have, number one, what we call immunopathy. Because of the high sugars in the body, their body cannot fight infections as well as a normal person. It feels a bit like a patient with quite immunocompromised. So therefore, any bacteria that the body could fight that would normally not get infected will now get infected in a patient with diabetes. Number two, okay, they are actually, interestingly, neuropathic. What is neuropathy? It means that because the diabetes have burned their little nerves on their feet and they can't even feel that injury. The third problem they have is what we call vasculopathy, where their blood vessels, okay, in fact, the very small little capillary blood vessels of their feet are actually blocked. That means that when they cut themselves, there's not a lot of blood actually flowing because there's not much blood there. And number two, whatever antibiotics they're going to take, right, in the mouth won't even go down to the foot because the foot is already having so low blood flow. And of course, they won't heal because they are immunocompromised. Their foot cannot fight the bacteria, they get infection. Eventually, even if they try to clean it and try to take antibiotics, the wound won't heal. The uniqueness of this team is that, one, we have the orthopedic surgeon, of course, who does the engineering of the foot, right? We know what is the thing to cut, how do we fix it up. We have the plastic surgeon that is the king of soft tissue cover. They will close the wound and they will flap it, graft it. You have the podiatrist, which is essentially the kings of offloading footwear. Lastly, but not least, you actually have the interventional radiologists who are actually running the endovascular stuff, because the interventional radiologist their training is really endovascular. It means they tunnel through the blood vessels to open up the blood vessels for us. A lot of patients then come back to me, those success stories, they come back to me and generally you can see a much happier person, a much healthier person, back to work, exercising, and they say, thank you, gotten their life back on track. So regular exercises, okay. Again, there are different categories depending on your age. And of course, a very healthy diet, a balanced diet. And of course, to prevent diabetes, we need to have good screening for ourselves as well, health screening, to know what we call the pre-diabetic state. In the pre-diabetic state is before you have diabetes, but your sugars are coming a bit up. This is where we want to detect. So regular health screening is important. If you do have diabetes, then of course, it's still the same, diet, exercise, and screening, but also the medications that are prescribed to be regular and comply with the medications and to be regularly followed up with your family physician or medical professional to ensure that your blood sugars are well controlled. Avoid being barefooted so you don't have that chance of getting injured or getting cut. Shoe wear is important. To protect the feet, I would recommend in terms of your job to regulate your shoe. For example, let's say if you are working in a safety site, not just your normal shoe wear, but even at work, do pay attention to be able to change your shoes to something more comfortable once you're done with your work. Always moisturize, okay, and do regular self-checks as well. And check for any cracks or any calluses, and watch over these